thank you for listening to Little Eyes, Big Topics. In this episode, expert pediatric ophthalmologists discuss the importance of advocacy in ophthalmology at the state and national levels, sharing strategies and opportunities for trainees to make an impact.
Welcome, everyone, to Little Eyes, Big Topics, an APOS podcast, American Association of Pediatric Ophthalmology and Strabismus. I'm Dr. Jenny Galvin, and as chair of the Digital Education Committee, on behalf of our committee, welcome to Dr. Alex Valentine, Dr. Michelle Falcone, and Dr. Michael Puente. This episode is going to focus on advocacy in ophthalmology and pediatric ophthalmology in particular.
Thanks, Dr. Galvin. Excited to be here. So I'm Alex Valentine. I'm a PGY4 resident at the University of Michigan at the Kellogg Eye Center, and I am currently applying for fellowships for pediatric ophthalmology.
Hi, and I'm Michael Puente. I'm a pediatric ophthalmologist at the University of Colorado and Children's Hospital Colorado. I serve as chair of APOS's Advocacy Committee, and I'm also currently the president of the Colorado Society of Eye Physicians and Surgeons.
And I'm Michelle Falcone. I'm a pediatric ophthalmologist at Bascom Palmer Eye Institute, and I am currently the vice chair of the APOS Advocacy Committee. I also serve as a delegate for the American Medical Association and the vice chair of Florida's delegation to the AMA, and on the board of governors for the Florida Medical Association.
I'll start with a couple of questions. So, Dr. Puente, I was wondering if you could start off, me being a trainee, you can kind of think about how you first kind of got involved in advocacy. So what led you to get involved in advocacy in Colorado and more nationally?
Sure. So I finished residency in 2019, and I really wasn't interested in advocacy until pretty close to the end of residency. I found out in my PGY4 year that there was a federal policy that says that gay men can't be corneal donors. And when I looked to see what the ophthalmology literature had to say about that policy, I was shocked to find that there was absolutely nothing. And as I dug into it more, I learned that that policy had been in place since 1994. And a lot of ophthalmologists knew about it, but no one had ever spoken up in any public way or in the literature to say that there might be a problem with saying that gay men can't donate their corneas. So I started a research project that turned into an advocacy campaign. In my last year of residency, I called every eye bank in the United States and every eye bank in Canada, which has a similar policy, to find out how many corneal donors they turn away each year just because they're gay. And I found out it's about 3,000 corneas a year. So I got that published shortly after I graduated residency in JAMA Ophthalmology. And then from there, I realized that my data and the research I had done about the safety of corneal donation by gay men needed to be heard by the powers that be. And so I mentioned that to the leaders of my state ophthalmology society here in Colorado, and they invited me to write what's called a council advisory recommendation, where I submitted a proposal to the American Academy of Ophthalmology for them to take a stand on this issue. And from there, things snowballed, and I got AMA involved, got Congress involved, and we've gotten the FDA to announce that they're going to change the policy. But working on that was the first time I'd ever been involved in advocacy. And it was so eye-opening for me that even a young ophthalmologist, a resident, can identify an issue and speak up on an issue in a way that can lead to change. So I've been getting more and more involved in advocacy ever since.
Wow. Yeah, that's amazing. And I feel like many stories I've heard, a lot of the advocacy starts with like there's some connection to like a loved one or yourself or something out there that makes it, a real issue for you and for people in your community.
Yeah, for sure.
And Michelle, so I was wondering the kind of same thing for you. How did you get involved in advocacy in your state in Florida and then more nationally?
So, my introduction to advocacy was a little bit different. It wasn't really centered around one specific issue. I first learned about it because my dad is a neuroradiologist and he's been a delegate for the AMA for a really long time. So, when I started medical school during my first year, they had our medical school chapter for the AMA and for my state medical society. And so I went ahead and signed up to be a member of those. And the summer after my first year of medical school, I actually went to the AMA conference. I did write a resolution for this first conference, and that was for the medical student section. It was definitely a learning process. It didn't get passed, but it was still overall a great experience because a couple of years later, it actually did get passed with some revisions. So once I started going to the meetings, I met a lot of great mentors in Florida. I met the leadership of the Florida Medical Association, and they really took me under their wing and started mentoring me and getting me involved with different committees through the Florida Medical Association and the American Medical Association. A little bit of a slower start into advocacy, and really I feel like my journey has been paved by those before me. They really helped me to get to where I am.
Yeah, definitely. That is another, interesting path to get into it. There was a personal connection as well. I think I also went to the AMA student conference in my medical school as well. So it's nice to have those kind of touch points. And Michelle, you were talking about the AMA. I think you've been going to these AMA conferences year after year. How was this summer's conference, and what were some of the kind of the big topics?
Yeah, so I've been attending the AMA meetings since I was a medical student. And, at first it can be a little bit intimidating when you start to go. There's hundreds of doctors there. There's definitely a steep learning curve. And it probably took me 2 or 3 meetings before I really understood what was going on and how to get resolutions passed. So, this past meeting, I would say definitely the top advocacy issue, probably over the last couple of years, is Medicare payment reform. Since 2001, when we account for inflation, Medicare reimbursements have gone down like 30%, which is really crazy. So, this puts physician practices at risk, and ultimately that leads to a problem with access to care for patients. So that's been the main advocacy priority for the AMA right now. There was a bunch of different other issues that we talked about. I would say scope creep is always at the top of that list. Every meeting, it seems to be a different specialty that, we're talking about scope creep. This particular meeting, it was the emergency medicine doctors and some of the issues they're having, but it definitely affects ophthalmology, and virtually, any specialty, can be affected with scope creep. So that's another big one.
Interesting. Interesting. Yeah, I was thinking the timing of this recording is funny because I was just attending a panel on advocacy at the University of Michigan with the University of Michigan students. And these were kind of first year medical students who had these amazing questions. And we were talking about the exact topics that you were just discussing. So this is kind of like really at the top of my mind. I know that for reimbursements, that is kind of like a state by state issue. So what can the average pediatric ophthalmologist out there help do, or how can they work with their state societies to make sure that this is a top priority?
I think it's important for pediatric ophthalmologists to be involved in their state societies because we're a small number of ophthalmologists. Most ophthalmologists don't take care of kids. And if the state society is made up entirely of adult ophthalmologists, then our issues might not get the attention that they need. And so it's really important for pediatric ophthalmologists to volunteer to be involved in their state societies. APOS actually gives an honor point or an award point for APOS members who are involved in leadership of their state society. And many state societies are really easy to get involved in. They're looking for volunteers. So I would encourage anyone who's interested in advocacy to get in contact with a state society and find out what opportunities there are for them to contribute. But the things that I think are important for us to speak up on as pediatric ophthalmologists are largely around Medicaid reimbursement. So AMA is very concerned about Medicare reimbursement, But as pediatric ophthalmologists, a huge percentage of our patients are reimbursed through Medicaid, which is generally funded by the states. And Medicaid is typically funded at a lower rate than Medicare or private insurance. So it's an issue that disproportionately affects pediatric ophthalmologists compared to our colleagues in the rest of ophthalmology. And it's primarily a state issue rather than a federal issue. So it's really important for pediatric ophthalmologists to speak up about this in their state societies.
I agree with everything that Michael just said. I'll just add, since it is a state issue, it does become a little bit trickier. We actually just talked about this at our last APOS meeting. We had an advocacy workshop and talking about Medicaid reimbursement and how to get, your state to make changes was one of the hot topics. The other thing that's important to consider is timing. So timing of when you're going to introduce this in your state is critical, because if your state society is fighting a big scope bill, it may not be the right year to introduce policy about increasing Medicaid payments. So that's the first thing to consider. The second thing is you also have to think about who is in Congress, right? So if it seems to be, a legislature that would be more amenable to passing that policy, then it might be a good time to introduce it. And, that's why PACs are so important. So I always encourage people to donate to their PAC because, through your state medical society PACs and your specialty PACs, you can really get medicine-friendly candidates elected. And this is how ultimately we get good policy passed for our patients.
I appreciate the clarification too of the state for Medicaid versus Medicare. And I think getting involved at these multiple levels is also kind of making me think about, as us, like for younger, early aspiring pediatric ophthalmologists, getting involved in advocacy can sometimes feel kind of daunting. It feels like you have to get kind of political, and there's a lot of, kind of like emotionally charged topics and subjects, and some people don't really like the idea of getting kind of quote political. And I think it's important to learn ways how to kind of overcome that. So how can we get and excite students and residents to get involved in advocacy in a way that shows that they can make like a real impact? Because I think you two are both such amazing examples of how you can make such large impacts with such, important, decisive actions and actually putting yourselves out there.
Young ophthalmologists bring a really important perspective. And the people who are representing us in our government, people in our state legislatures, in Congress, at federal and state agencies, they often want to hear our perspective, that they're making rules and policies that affect eye care and ophthalmology, and they might not know much about the issues that we're facing. And so, as president of the Colorado State Ophthalmology Society, I've been bringing a lot of our residents from the University of Colorado to meet with legislators. And they can talk about real issues they've encountered taking care of patients at our county hospital and our children's hospital, and patients whose care was harmed because of government policies or government or laws, and things that we would like them to change. For example, one issue that a lot of our residents were really excited to contribute to was that we introduced a bill in Colorado this year to allow ophthalmologists to send patients home with any leftover medication at the end of surgery, like the antibiotics or steroids that we use at the end of many of our surgeries. Most of the hospitals in Colorado tell us that once you put those drops in at the end of the case, you're supposed to throw the bottle away and then send the patient out to a pharmacy to go buy another bottle of the same one that the hospital made us throw away. And the residents had so many stories of patients who were harmed by that they couldn't get the drops in time. And so we introduced a bill through the Colorado State Ophthalmology Society to allow doctors to do that and ban hospitals from making us throw that medicine away. And I was the only attending ophthalmologist that testified in any of the legislative hearings about it. We had about 10 residents and fellows all come and share cases. And it was something they were really passionate about. And the legislators were so excited to hear from these young future doctors of Colorado.
That's excellent. That is very exciting. I mean, that makes me want to go and take up the Michigan fight for this, because I think I was at this panel. I was speaking with one of our glaucoma fellows, Dr. Charlie Frank, and I think he is helping to work on a similar bill on medical waste in Michigan as well. So I'm glad that this is happening everywhere.
It's not happening everywhere, but it could be. The law that we got passed here in Colorado, I think we were only the fourth state in the country to pass a law like that. So there's 46
Oh,
to
wow.
go. And this is something that could be really easy for a young ophthalmologist, a trainee, to spearhead. There's sample legislation from the American Academy of Ophthalmology that can be molded to your state's conditions and situation. And it's an easy opportunity for young ophthalmologists to get involved in advocacy and in a relatively easy, non-confrontational way that can reduce waste, reduce cost, and improve patient care.
Well, there you go. Medical students, residents, young ophthalmologists listening. There's your call to action. One of many.
I think one of the other key things is just finding good mentors. And that's really what I would say to the medical students and residents and fellows that are listening to this. Find a mentor who is very involved in advocacy and just ask them if you can go to a meeting with them. I'm sure they'd be happy to take you along. Ask if there's any councils that you can get involved with. There are so many opportunities, and once you start, then more opportunities are gonna open up, and you'll figure out what interests you and in what way you want to become involved.
And I'd also add another great way for trainees, young ophthalmologists to get involved in advocacy is to go to the American Academy of Ophthalmology's mid-year forum as an advocacy ambassador. So Mid-Year Forum is an annual meeting where ophthalmologists from all across the country come together and talk about issues affecting their subspecialty. APOS has 2 representatives, and every state society sends representatives to talk about what's going on at their local level. And all of ophthalmology comes together to discuss what's happening in all the different areas of ophthalmology and kind of problem solve together, and then also go and meet with your representatives in the House of Representatives, meet with your senators, and talk about the issues affecting ophthalmology and our patients. And most state societies will pay for trainees to go to this for free. Many ophthalmology departments do, many state societies. It's an easy way for residents to just get some exposure to this if it's something that's at all interesting to them.
Definitely. Yeah, I am. I know we've sent residents every year, and I've heard nothing but amazing things. I'm hoping I can go next year. I'm also thinking about how each of the individual ophthalmology societies have their own kind of advocacy sections. Like I went to APOS this year, and I went to the advocacy, section. I got to hear, some amazing people speak. I was kind of sitting in the audience and taking it all in. So I'm hoping that this is kind of exciting people to just learn, expose themselves more, and then they'll find something that they'll connect with and then maybe run with it. So thinking ahead, what Dr. Puente, thinking in Colorado, what do you think in the future is the next most important key issue kind of at like the regional state level? So we've touched on a couple important ones. Is there another one kind of on the horizon that you have as something you're focusing on or that the state is focusing on?
Something that we unfortunately have to always think about that Dr. Falcone was talking about earlier is scope expansion, scope creep. And that's something that we deal with, obviously, as ophthalmologists, with optometrists constantly coming back to our state legislatures asking to do things that they're not trained to do. And we unfortunately lost a scope battle in Colorado just a few years ago, but we anticipate that they'll be coming back and asking for more in a few years. And so that's something that in the back of our mind, we're always trying to be prepared for, vigilant, and setting ourselves up that we are not only speaking to our legislators when there's a crisis, but that we have ongoing dialogue with them, and that they see us as real champions for patient care, for improving the vision of the people of Colorado. That anytime they have a question about an eye-related issue, that they know that they can go and speak to the ophthalmologists about it. And we thought that our bill this year that reduced costs in Colorado and improved patient outcomes in Colorado was a great part of that. And so we have other ideas for ways to reduce the cost and improve the sustainability of eye care in Colorado. And then we're also, we're a state that tends to fund Medicaid well compared to other states, but that's something that is always on the chopping block. And when Medicaid rates are cut, it hurts patient access. It's something that causes a lot of practices not to accept as many Medicaid patients, which makes it a lot harder for these people to get the care that they need. And so we're always monitoring things that could potentially hurt access to patient care in Colorado.
Yeah, that made me think about, kind of, as I was thinking about choosing pediatric ophthalmology and the shortage of pediatric ophthalmologists. I think there's this, really big perception that Medicaid reimbursements are contributing to, like, the financial incentives of people going into pediatric ophthalmology versus other subspecialties. And I've heard it from, people around me. So it's making me kind of wonder if it's also going to be another factor of, like, how do we support our workforce if Medicaid keeps on getting cut.
And there is a big workforce shortage. Many states don't have anywhere near enough pediatric ophthalmologists. Here in Colorado, we're surrounded by states that have very limited pediatric ophthalmology care. There are plenty of pediatric ophthalmologists in Denver, Colorado Springs, but in the whole rest of the state, there's almost no one. And in New Mexico, there are just a few pediatric ophthalmologists who work so hard and take care of so many patients, but there's only 3 of them, I believe. And Wyoming, just to the north of us, has not a single pediatric ophthalmologist. Each of the Dakotas only has 1. So anything that's discouraging people from accepting Medicaid patients or discouraging trainees from going into pediatric ophthalmology is a real threat to pediatric eye care.
Dr. Falcone, similar question to you. Are there a couple, or maybe one other kind of topic on the horizon that you have that maybe is kind of in its earlier stage or kind of in its, like, infancy, that you see as kind of playing a big role in the future of the Florida advocacy scene?
Sure. So, one thing that we haven't talked about that is probably going to be really important in the next decade is the role of AI in healthcare. This technology is evolving so rapidly, and physicians really need to be on the forefront of setting guidelines for AI use in medicine. And there's still so much that we're learning and figuring out how to use this technology and how to implement it. And if it is used, how does that affect things like reimbursement, right? That's going to be really important. And so that's not just important for Florida, though. That's really important for everyone.
And I was wondering, in terms of APOS itself. So as a resident, I'm an APOS member, hopefully lifelong. And I want to know, what is APOS doing in the advocacy space? I'm wondering, kind of, both of you, what have you seen going on? What's happening?
Advocacy is a big priority for APOS. In surveys of APOS members, advocacy has again and again come up as members' most important priority, that they think APOS needs to speak up more about issues that are affecting pediatric ophthalmologists and our patients. So APOS has put a lot of skin in the game by hiring a lobbying firm, Polsinelli, that we've been working with now for almost 2 years. And they've been working with leadership of APOS, with leadership of our advocacy committee, and with representatives of a lot of state societies across the country to try to position us to improve policy affecting pediatric ophthalmology, have a voice, and bring our concerns from APOS to the people who are in a position to make change in our government.
One of the biggest things on our agenda is the physician workforce shortage that we're facing in pediatric ophthalmology. So that's one of our top priorities, and we're trying to tackle that partially by improving reimbursements for Medicaid. So that's something that we're working with certain states on, and then we're also working on certain efforts on a national basis to try to improve Medicaid reimbursements.
Another thing we're working on is trying to make sure that every child in America gets a vision screening. Currently, 40 states and the District of Columbia require schools to screen children's vision and refer them to an ophthalmologist or an optometrist if they fail the vision screening. But there are still 10 states that don't require that. And so many children are going through school with vision problems that are undiagnosed. And so that's a goal of APOS, is to get legislation like that passed in all 50 states. And we're really close.
That's amazing and so exciting. These are such important things. I'm glad APOS is really doing a lot. This has been an amazing conversation. I've loved learning from both of you. I mean, I was already very inspired to get involved and become a pediatric ophthalmologist, but I'm really reared to go because there are so many things that that need working on. And I hope this is also an inspiration to anyone listening, students, residents, young ophthalmologists, to really, take charge, attend a meeting, reach out to someone, find a mentor, just start with something small. And I feel like that's kind of what I've heard, is that you just kind of start small and then things they can snowball and turn into really big things. And that's very inspiring. So I appreciate you guys sharing your stories.
Thank you for having
Thanks
us.
for having
This has
us.
been a lot of fun.
Thank you again to Dr. Falcone and Dr. Puente and Dr. Galvin. This has been a great conversation. I appreciate it.
And this wraps up a fantastic conversation between our resident, Dr. Alex Valentine, and our thought leaders in the area of advocacy and pediatric ophthalmology, Dr. Michelle Falcone and Dr. Michael Puente. Thank you so much for joining us. And thank you for listening to APOS Little Eyes Big Topics podcast.